On March 23, 2010, President Obama signed into law the Patient Protection and Affordable Care Act. This legislation, along with the Health Care and Education Reconciliation Act of 2010, makes sweeping changes to the U.S. healthcare system. This includes an extension of health insurance coverage for adult children up to age 26. Though many of the changes will become effective over the next several years, the extension of coverage to adult children takes effect in as little as 6 months from enactment. So what does this law require? Health plans that provide dependent coverage must make this plan available for adult children up to age 26, regardless of their marital status. An insurer cannot restrict coverage for any of the following reasons. The child is not financially independent. The child does not live with the parent or guardian. The child is not a full-time student, or the child is not employed. There is no requirement, however, for a parent to cover their child up to age 26. Child is an individual who is a son, daughter, stepson, stepdaughter, or eligible foster child of the taxpayer employee. Though the coverage requirement ends on the child's 26th birthday, employers can continue to offer this benefit until the end of the plan year with preferential tax treatment on the extension. The extension of the dependent coverage provision takes effect for plan years beginning on or after September 23, 2010, though it can be adopted earlier. Insurance companies are following different time frames relative to implementation of this new legislation. While some insurance companies are waiting until the stated effective date, others have already extended coverage for dependents. Employers are faced with many issues relating to the requirement to extend health insurance coverage to adult children. Some of the issues employers should be aware of and should consider taking immediate action on include confirming coverage changes, including possible early implementation with TPAs, insurers, and stop-loss providers, determining whether there is a cost impact to the employer, revising plan documents, enrollment materials, and other employee communications, reviewing payroll practices for necessary adjustments, considering establishing who is and who is not a tax dependent, reviewing vendor agreements to determine the need to coordinate communication and notice responsibilities with insurers, and reviewing COBRA treatment of the individual. The interim final rule implementing this new mandate will likely be amended after the public comment period ends on August 11th. JRG Advisors will keep you informed regarding this and other legislative initiatives.